Hey everyone, welcome back to the channel. With COVID-19 cases on the rise again, it's important to stay informed about all aspects of this disease. In today's episode, we're focusing on a crucial topic that has been gaining attention: long COVID. Let's dive right in. Long COVID, also known as long-haul COVID, post-COVID-19 conditions, chronic COVID, or post-acute sequelae of SARS-CoV-2, refers to the health problems that some people experience within a few months of a COVID-19 diagnosis. While most people with COVID-19 recover within a few days to a few weeks after infection, some individuals continue to experience symptoms for weeks or even months after their initial illness, and researchers are still working to understand why. Some people may seem to recover from COVID-19 but then experience a return of symptoms or develop new symptoms within a few months. Even those who had no symptoms when they were infected can develop symptoms later. Scientists are still investigating the exact underlying processes that cause of long COVID, but research has provided some clues. One possible mechanism is that SARS-CoV-2 particles, the virus that causes COVID-19, may become active again in the body, leading to the reemergence of symptoms. Another potential factor is the overactivity of immune cells, which can release high levels of inflammatory substances that may injure organs and tissues. Additionally, the immune system may produce autoantibodies that mistakenly attack a person's own organs and tissues, leading to further complications. Studies have indicated that individuals who experience severe cases of COVID-19, including hospitalization or intensive care, are more likely to face long impairments. However, long COVID can also affect individuals with mild symptoms. Researchers are currently identifying risk factors associated with long COVID and investigating the reasons behind the variation in symptoms among individuals. Those with underlying health conditions such as diabetes, asthma, autoimmune diseases, or obesity, as well as those who did not receive the COVID-19 vaccine or experienced multisystem inflammatory syndrome during or after their COVID-19 illness, may be at higher risk for developing long COVID. Other identified risk factors for long COVID include female sex, older age, depression, anxiety, post-traumatic stress, an impaired immune response to the initial infection, and the specific variant of SARS-CoV-2 that caused the initial infection. Long COVID is a complex and challenging condition that can affect various areas of the body, presenting a wide range of symptoms that can vary greatly from person to person. These symptoms can persist for weeks, months, or even years after the initial COVID-19 illness and may result in significant disability for some individuals. One of the most common symptoms experienced by individuals with long COVID is fatigue, lack of energy, and muscle weakness, which can be debilitating and significantly impact their daily activities. Sleep problems, such as insomnia and restless leg syndrome, are also prevalent in individuals with long COVID, further adding to the burden of their condition. The brain and nervous system are frequently affected by long COVID, with many individuals experiencing cognitive dysfunction, often referred to as brain fog. This includes problems with thinking, concentrating, and remembering, which can be frustrating and impair one's ability to perform cognitive tasks effectively. Headaches, dizziness upon standing, and mood symptoms such as anxiety or depression are also common in long COVID. In some cases, more severe neurological manifestations, such as tingling, numbness, nerve damage, and even seizures or dementia, have been reported, further highlighting the wide range of symptoms that can occur. The eyes and ears can also be impacted by long COVID, with changes in vision, eye redness, and hearing loss or ringing in the ears affecting some individuals. Loss of smell or taste is another hallmark symptom of long COVID. This can significantly impact an individual's quality of life and affect their ability to enjoy food and beverages. In addition, loss of appetite and increased thirst may also be present in some individuals. The neck can also be affected by long COVID, with some individuals reporting neck pain that spreads towards the ears and swelling of the thyroid gland. The respiratory system, which is primarily affected during acute COVID-19 infection, can also continue to exhibit symptoms in long COVID. Shortness of breath and a persistent cough may persist in some individuals, further adding to the respiratory burden in these patients. Cardiovascular symptoms can also be present in long COVID, with some individuals experiencing chest pain, a rapid or irregular heartbeat, and fainting. Kidney-related symptoms, such as pain on the side of the body and changes in urination, may also be present in some cases of long COVID, adding to the complexity of the condition and its impact on multiple organ systems. Long COVID can also affect the hands, legs, and feet, with symptoms like shaking of the hands and swelling in the legs or feet being reported in some individuals. Reproductive systems can also be impacted, with symptoms like erectile dysfunction, changes in the menstrual cycle, short-term male infertility, and worsening premenstrual symptoms have been reported. Digestive systems may also be affected, with symptoms like stomach pain, changes in appetite, diarrhea, constipation, heartburn, and changes in stool color being experienced by some individuals with long COVID. Skin and hair can also be affected, with symptoms like rashes, hair loss, and yellowish skin being reported. People with these unexplained symptoms may be misunderstood by their healthcare providers, which can result in a long time for them to get a diagnosis and receive appropriate care or treatment. Long COVID is diagnosed based on a person's health history, including a positive COVID-19 test, symptoms, or exposure, as well as a health examination by a healthcare provider. There is no specific test to determine if symptoms or conditions are due to COVID-19, as long COVID is not a single illness but rather a range of health problems that can vary from person to person. There are no established pharmaceutical treatments specifically for long COVID, but there are ongoing clinical trials to determine the effectiveness and safety of potential therapies. The management of long COVID depends on the symptoms experienced by individuals, with current guidelines recommending multidisciplinary rehabilitation to improve symptoms and quality of life. Rest, planning, and prioritizing are advised for those with fatigue. Activity management with pacing may be beneficial for those with post-exertional symptom exacerbation. Antihistamines may be helpful for individuals with allergic-type symptoms such as skin rashes. Routine screening for mental health conditions, such as post-traumatic stress, is also recommended. Persistent olfactory dysfunction or loss of smell can be treated with medications such as corticosteroids and luteolin, though their effectiveness is still not clear. To sum up, long COVID is a complex and challenging condition, and the best way to prevent it is to avoid getting COVID-19. Research suggests that vaccinated individuals who experience breakthrough infections are less likely to develop long COVID compared to those who are unvaccinated. Therefore, staying updated with COVID-19 vaccines and boosters, and taking preventive measures such as avoiding close contact with those who have confirmed or suspected COVID-19 and practicing good hand hygiene are effective ways to avoid getting COVID-19. Thank you for tuning in today. I hope this video has provided you with valuable insights and a better understanding of this ongoing health challenge. If you found this information helpful, please give this video a thumbs up and share it with your friends and family. Don't forget to subscribe to the channel for more informative content. Stay safe, take care of yourself, and I'll see you in the next video.